Hello, everybody, and welcome to today's Prevention Matters panel session. Prevention Matters is a monthly online panel that's hosted by the Canadian Observatory on Homelessness, where we dive into what it means to prevent homelessness in our various communities. Most of us know that prevention is necessary if we want to solve the current homelessness crisis, but this series exists because if we want to address homelessness through prevention, then we must be clear on what prevention means. So, what can we do to reduce the chances that someone will experience homelessness in the first place? What can be done to support people who are at a high risk of homelessness or have recently become homeless? And how can we ensure that people who have experienced homelessness and who are now housed don't face housing precarity again? To delve into these questions, Prevention Matters invites brilliant minds to tell us about how prevention looks in their work, along with the lessons they've learned along the way. If you've watched a couple of our episodes, then one thing you've probably heard several people say at this point is that when it comes to addressing homelessness, it's actually more cost effective to invest in preventing it in the first place. While investing in affordable and appropriate housing can seem like a significant upfront expense, many of us in research know that the consequences of inaction are far more costly. When we choose not to invest adequately in housing for the poorest Canadians, healthcare, justice, and other taxpayer funded costs increase dramatically. To demonstrate why this is the case, today's panelists have come ready with the receipts to break down the cost comparisons from their work so that we can all understand once and for all that yes, it is in fact cheaper to invest in preventing homelessness than it is to continue reacting to it with band-aid solutions. Before we get into it, however, I wanted to take a moment to shout out some other cool folks in the sector who are doing some similar and important work. So, sorry, and I got by flu season this weekend, so if you hear a couple random sniffles and things, just bear with me. I'm so sorry. Uh, anyway, moving on to shouting out this really cool project in the sector. If you like what we're doing here, I'm sure that you'll like On the Way Home too. So I'll invite you to tune in every tune in every Thursday to Blue Doors podcast, which is called On the Way Home. It's a very thought-provoking podcast that's hosted by Michael Braithwaite. Every week, you'll hear from inspiring community leaders and dedicated advocates who are discussing the ongoing challenges in the housing sector across Canada. This podcast is more than just conversation, it is a platform for real dialogue and actionable insights. Subscribe today from your favorite podcast platform and join them every Thursday. Together, we can work together towards a more compassionate future, one conversation at a time. Discover truly inspiring insights, real life stories, and practical solutions that empower communities to overcome adversity and build a brighter future for everyone. For more information, visit their website at onthewayhome.ca. Focusing back on today's panel, though, I wanted to remind you that these sessions are not your typical webinar. Your participation is a key part of this experience, and so we strongly encourage you to engage among yourselves in the chat and ask any and all questions you might have during our open Q&A in the second half. I also wanted to remind you that your feedback is very important to us, and so if you have any thoughts on how we could improve your experience, we'd really appreciate you sharing them with us. Please take a moment to make use of our feedback form in the chat because we do want to hear from you. The session will be recorded and shared publicly on our YouTube channel. So if you would like to maintain your privacy, I'll invite you now to turn off your video and rename yourself using the tools at the bottom of the screen. Since we're gathering online today, a single land acknowledgement doesn't capture the richness of our many locations. The Canadian Observatory on Homelessness is based in York University, Toronto, so we will share their land acknowledgement. However, we invite all guests to consider their position regarding the land in which they find themselves. So we acknowledge our presence on the traditional territory of many Indigenous nations. The area known as Toronto has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So, to kick us off, each panelist is going to give us an overview of their work and highlight some key stats from their insights before getting into the main interview part. Without further ado, I'm going to invite our first guest to the floor to introduce herself and tell you a little more about her work. Everyone, please join me in welcoming Lucy Richard to the stage, so to speak. I know it's a virtual stage, but y'all get the picture. Lucy, please go ahead and introduce yourself before telling us a little more about your work. The floor is yours.
Hi, everyone. My name is Lucy. I'm a senior research associate and adjunct scientist at MAP Center for Urban Health Solutions in Toronto. I'm a geographer by training, also a health services researcher, and I'm joining this panel today because I led a study a while back that estimated the public healthcare costs of a large representative sample of people experiencing homelessness. That study followed a random sample of several hundred people from various homeless settings across Toronto. We then matched each of those individuals to several housed and low-income housed controls, and we followed them for a year through their administrative health records to measure and compare their individual level healthcare costs. So this would include all forms of healthcare, including hospitalizations and psychiatric admissions, ED visits, family doctors, walk-in visits, and so on and so on. The paper is open access, so if it's possible, I'll drop the link in the chat in a moment here, but just to briefly highlight the main takeaways. First off, and perhaps most obviously given today's discussion, we found that the unhoused cohort had several times higher healthcare costs than both the housed and low-income housed groups, with homeless healthcare costs averaging about $12,000 for 1 year. But the range was extremely large, with some individuals having zero costs while others having costs in excess of $300,000. But the difference between groups wasn't due to outliers. Differences began and existed from the 25th percentile onwards. The second key takeaway was that disparities were present for every subset of healthcare we assessed, not just hospital and ED visits, which is what folks tend to think about when they imagine healthcare for people who are homeless. Third, after adjusting for things like number of chronic health conditions or presence of mental health or substance use issues, our homeless group had still almost 6 times the healthcare cost of the house group. In other words, although these factors are important to consider, they don't fully explain why healthcare costs are so high among people who are homeless. And this is an especially important point for folks who tend to incorrectly conflate homelessness with substance use and mental health. They are distinct issues. And finally, mean healthcare costs doubled in the past decade, which outpaced both inflation as well as increases to per capita healthcare spending in Ontario during that same period, which we infer from that the situation appears to have worsened in recent years. So not a happy note to end on, but I'm going to take that moment to pass it on to Melissa to introduce herself next.
Thanks so much, Lucy. Melissa Giles, I'm the managing director at BC Rent Bank. I use she, her pronouns, and I'm joining you today from the traditional unceded territory of the Stolo Nation, specifically the Squakale, which is known as Chilliwack. And BC Rent Bank is a project of Van City Community Foundation with funding from the provincial government. And I represent a network of rent banks across British Columbia and the important work that they're doing. And I've been in this role since 2019 and connected to rent banks since about 2017. So what a pleasure it is to be invited. I feel like I'm in a different league with a lot of researchers. I should note that I am not the lead researcher on the report that we published in December. Kudos to my colleague Bryn Sedonik on her work there. But we did want to come today and share with you some of the results of what we found in that study. And talk to you a little bit about it. And similar to Lucy, we'll try to drop a link or make sure that you have access to the report, which is called Why Eviction Prevention Matters. And if you want the extreme Coles notes or the shortened version of what we found, it's really, really cost effective to invest in eviction prevention. And it doesn't take a lot more than to say that. But the focus of the study and what we wanted to do was to look at what would happen to tenants if they hadn't been able to access a rent bank. And then we wanted to look at the personal and public costs associated had they not been able to access that service. And so I'll just share this one slide with you right now that sort of also highlights some of the findings from that. But as you can see here, what we did is we really looked at the number of households that we were able to help in the rent bank world in 2023, 2024. So those are about 1,500 households, and looked at, what would have happened to individuals. So 600 plus of those we were able to prevent from becoming homeless, and over 1,000 households prevented from spending more money on their rent. And so this study really looked at what are some of the private costs as well as some of the public costs associated had that person lost their housing. And so the findings were that in just that 1 year of support, there was a $27.5 million savings. And on the right side, you can see it's sort of broken down by costs. And I'll speak a little later in the presentation as to what some of those private and public costs were. But you know, eviction prevention matters not only on a moral level, it's not only the right thing to do, but this study also showed us that it's a cost-effective thing to do. So by investing $1 in the rent bank program, we saw $5 savings in return. And so, yeah, we're happy to share that with you today and to talk a little bit about this report. And I think what has already been mentioned, and I'm guessing is known within this group that has gathered, is that there are far more a large benefit or a range of benefits such as, you know, health and family stability, child development, educational achievements, and things like this. So yeah, we're happy to share that with you today and talk with you a little bit more in depth. But I'm going to pass it over to Sarah.
Great. Thank you so much, Melissa. Hi, everyone. My name is Sarah Farabee. I am a program coordinator of collaborative planning and projects with the City of Ottawa. So within that role, I get to do a lot of strategic work and sort of systems planning on homelessness and homelessness prevention. I'm not a researcher. I'm here today to share the results of a program, but I don't have any published work on it. I would like to share that if anyone wants kind of more details, following this webinar, I do have, you know, like an overview and other information I'm happy to share about the program. The program I'm going to be talking about today is called Bridge Funding. And before I talk about that, I just want to say that I'm here representing a pretty large team that worked on this project from all sorts of areas in the city. We have people from Employment and Social Services, Ontario Works, our rent supplement team, our data team, our legal team. This was a big lift, and I just want to make sure that those people are acknowledged here as well. The project itself was really innovative and different for the City of Ottawa. We didn't have anything like it before. And basically what it is a short-term, low-barrier housing benefit that is offered to clients of Ontario Works who are at what we call imminent risk of housing loss and homelessness. We began this pilot in 2002, and it took about 8 months to stand it up before we could start delivering it for some reasons that I think we'll talk about later today. But the idea is that a client on Ontario Works who's identified as being at imminent risk of homelessness by their caseworker becomes eligible, but they must participate in a more intensive case management and work towards a housing stability plan. So they'll work with their caseworker over a maximum of 6 months while receiving a benefit that tops up their rent over and above their Ontario Works shelter benefit. And over that time, we've seen a lot of success in people stabilizing their housing and staying in situ in their existing units, which are generally less expensive units than ones if we have to help them find new housing due to the increased cost of rent that we've seen across the country. Can I get you to share the slides, Promise, and just have some stats to share with you? So we do our roundup for this program quarterly, so I don't have the information up to March, but up until December 2024, our expenditures were just slightly over $1 million. And we had worked with 345 households, which impacted just over 630 individuals, because a lot of those households have other people in them, and especially for the families, there are children. 87% were single adults, but many of those have children. So they're single adult-led households, and about 13% were couples. And actually 2/3 of the households do not have children. But of those, 89% of the households who received this benefit did avoid homelessness. I think the next slide will show you, I think, what we're all here to talk about today. So you can go to the next slide. Thanks, Promise. This should be, I think, not a huge twist. But what we know is that after having done this since August 2022, it is much less expensive to prevent the homelessness for these households than it is to have them in shelter. For single adults, to Average out, the average benefit, it's $20 a day, and in shelter, it is $59 a day. And that is kind of the least expensive of our shelter options. So just that alone is over 200% more expensive to be in shelter. But clients who are in other shelter circumstances that I can speak to later, it's over 400%. For families, the average benefit is slightly higher for prevention at $29 a day, but the average shelter cost is much, much more. And that is because not just the cost of having multiple people in shelter and family, but also because Ottawa relies heavily on offsite services such as hotels and motels. So we're talking almost 500% more per day. This does not consider system level costs, and it does not consider, very importantly, the personal cost to individuals when they experience homelessness. So I would just say this is not, we still have a really difficult situation in Ottawa. We have very high shelter numbers. Our shelters are far above capacity, so it hasn't been a golden ticket. This is not a program that has solved homelessness in Ottawa for everyone, and it's only available to those on Ontario Works so far. But we've learned a lot, and we're really proud of the work we've done so far, and the program has been adopted into our regular programming. So I look forward to discussing that a little more with everyone else here who has this interest in prevention. I think it's really important, and I'm happy to be here today. Oh, and I'll pass it back over to Cedar.
Thanks so much, everybody. I really appreciate getting the overview of each of your work, and we'll get to dig into it in a little more detail shortly. But my name's Cedar Michel. I'm the French content coordinator at the Canadian Observatory on Homelessness, and I work on the communications team with Promise. So I'm pleased to get to join you all today for this important discussion. So while we're going through the next section, which is all kind of a more structured interview, we encourage everybody in attendance to share questions that you have for the panelists as you're listening. So feel free to use the Q&A feature at the bottom or just throw your questions in the chat, and then we'll ask them to the panelists at the end. So before getting into some of the nitty-gritty behind the numbers that you've shared, we wanted to start by talking about some of the why and the how of each of your projects. So our first question is, what happened in your context to motivate this work in the first place? And how did you go about exploring the issues underlying your project? And I thought I could invite Lucy to start on that one, if you don't mind.
Yeah, no problem. That's a two-part question, so I'll kind of approach both separately. So motivation, like why we went ahead with this, I don't think I'm in good company in here in terms of having noticed the tendency for folks to think about homelessness interventions in terms of their cost, which is a little weird, and I don't really agree with the underlying premise behind that, but the views are fairly prevalent, and they're also very influential with bureaucrats and CEO types who make the decisions on what to fund. So despite how I feel about the idea of thinking about cost, it's important as a research community for us to do what we can to provide good information, not just about the health and well-being consequences of homelessness, but also program type information that helps inform the business case for interventions. Otherwise, you end up in a situation where you see interventions, you see the cost of the interventions, and you consider those on their own without considering the offsets created by those interventions, which Sarah and Melissa have both talked about a little bit, and you end up risking good projects not happening or not being implemented as designed. So that's more or less in terms of the motivation for why. In terms of the how, we already had a data collection that we had undertaken for other reasons, in which we had fairly broad consents for and to address this research question. This was just a first pass, actually, and our approach was to compare baseline healthcare costs between groups to infer what would be the excess that's associated with homelessness. And to do that, as I said before, we matched a number of controls to each of our homeless participants. And we did two separate control groups. One was what I'd call a general population group. And the other was low-income individuals, people who lived in the lowest income neighborhoods. And we did have these two different groups because we wanted to distinguish between the effect of homelessness with that of low income or poverty. And then as I said, we followed these groups to measure their healthcare costs through their health encounters. And I won't get into the methodology for the costing bit because that's maybe a little bit too much nitty-gritty for this audience here. But I did provide the costing paper for people to look at that. I'm happy to reach out to anyone who has more interest in the costing methodology, but the upshot is that we do have a fairly decent individualized estimate of the cost of the healthcare that person received over the year, which then allowed us to compare the cost across groups, as well as adjusting our disparity estimates for other things that we didn't.
I think we might have lost Lucy's connection for a second there.
Okay, maybe we can go on to Melissa and then we can come back. Oh, Lucy, are you back?
Yeah, I
Sorry.
didn't realize that I had. Yeah, was I frozen a long time?
Maybe 20 seconds.
Okay. Yeah, I'll let others talk and I can circle back.
Sure. Thank you very much. Melissa, are you good to go next?
Yeah, sure. I'd love to. I think, it's kind of really nice to be with these panelists today because we're all sharing language and sort of you don't have to convince or create the stage of why this work is important. But the motivation for us is really, there's a couple of reasons. One is we know that evictions are disruptive and they can cause crisis amongst families. They not only have economic results or impacts, but they also have emotional and economic, social, psychological, all of these kinds of things. And particularly in BC, we're facing a housing crisis, as I think a lot of us are across Canada. So BC continues to lead the country, unfortunately, in statistics that aren't all that ones that we want to share that often, but we have some of the highest 5-year eviction rates, double the national average. 85% of evictions or households in BC were no fault evictions compared to 65%. And British Columbians are 30% more likely to experience no fault evictions than the national average. And so we really came at this report, Lucy alluded to this, but you don't always want to look at these things from an economic point of view. But unfortunately, decision makers, when they look at the cost benefit, that's really what helps to persuade. So we are funded by the provincial government and we need to make a case for support as to why investing in these programs is so important. We also wanted to just add to the body of knowledge. So as I mentioned earlier, I'm not a researcher, but as we looked at some of the data that was out there, we wanted to enhance the knowledge around what are some of the costs that are associated with eviction and make sure that we can add to that body of knowledge. If you review the report, you'll notice that we refer a lot to CMHC, as well as in British Columbia, we have a great program that's run by First United called the Evictions Mapping Project. So these kinds of data points are helping us, but we wanted to really add to that. So for us, as far as our approach, obviously we began with a few questions and they're kind of alluded to in the report, but things like what would have happened to those households had they not been able to access a rent bank? What costs were likely avoided? Are there benefits to preventing evictions other than just the cost of administering these types of programs? And so what we did is looked at the 2023-2024 year and looked at how many households had avoided eviction because of rent bank assistance. And we used information from a housing stability survey that we did a few years ago and developed a scenario out of this. And so what would have happened had they not been able to maintain their housing? And so you'll see in that report that, there was prediction of about 75% of those households would have likely found another rental. And so that's where we developed some of the private costs associated with it. 25% of those households would have experienced either short-term or longer-term housing. And we broke down those costs as well, based on data and research around, how long does somebody typically experience loss of housing? And so then we went about developing a cost estimate. So we looked at the private costs for renters, and we also estimated the public costs for government and determined the total avoided costs. I think it's important to note that there are things that we did not include in that, which would be things like policing and costs to the judicial system, other first responder and civic services. So these are become difficult, and even when you have this conversation, what are you including in these costs and what are you not including? So when we break down into later on some of those private and public costs, we'll also be able to identify that. But it gets pretty complex when you start to think about, what are we including in these estimates? But for this reason, we also think that our estimates are conservative. So even when we talk about the fact that it's a 5-to-1 savings or a $27.5 million savings, We think those are actually quite conservative. So that's a little bit of the background as to the motivation and the approach that we took in this report. Thanks.
Thank you for that. Sarah, please.
Thanks, Cedar. And just before I speak to kind of how we ended up where we are today, I just wanted to share, I saw someone in the chat asked, what is Ontario Works? So just to do a little level setting, since we're all across Canada, Ontario Works is the province's social assistance program. So if there's any other questions or language that I'm using that might be too Ontario specific, just reach out and flag it. But I will say that what kind of launched this for us is not Ontario specific. I'm sure you all remember in 2020, we had a pandemic, and that pandemic really created significant challenges within the municipality, within the city of Ottawa, all across the country for all of us, I know, in the work that we do. But specifically in Ottawa, which is where, you know, I can really speak to what happened here. The way we responded within the shelter system was that we opened up community centers and had beds within those community centers in order to increase our shelter capacity, because we had a need to distance our current shelter clients for their health and safety, and because we were seeing an increase in need for shelters. At the maximum, we had 4 community centers that were being unused due to the pandemic open, with a capacity of 800 beds for singles. And for context, the single shelters in Ottawa otherwise have a capacity for 1,200 beds, or did at the time. So we almost doubled our single shelter. And in the family sector, we were operating at something like 350% capacity. It was really a scary place to be in for those of us who were working in that system. And then the eviction moratorium and rent freeze that took place in Ontario ended, and we began to see more inflow. And so we were having very serious discussions in Ottawa about how to prevent homelessness and stop this inflow and just try to manage the situation we already have at hand. And we had very stretched resources and a lot of competing needs. We would hear people say, you know, like, I've lost my job. I haven't worked in a year. I'm going to lose my housing. I'm in arrears. Like, I'm going to become homeless. What can we do? And all we could do was say, you know, like, well, I hope you don't, like, but if you do, you know, then once you're here, we can talk about your options. And that is a really big problem. So we received some unallocated funds, so a bit unexpected federal funds. And we thought, like, hey, what can we do with this? Because all of our other funds are fully allocated. So how can we work with this problem? And I remember I was in a meeting with a caseworker, an Ontario Works caseworker, and they said, we know exactly which of our clients are about to become homeless, but we have nothing we can do. There's nothing we can offer them until they are. And this was one of those moments that just like really struck a chord with the people in that room. And so at that point, we took that away and we said, okay, let's think about what we can do specifically through this avenue to prevent that. So we just started digging a little deeper, because we know that our Ontario Works caseworkers, they're about 600 in the city of Ottawa, work very closely with their clients, and they're very boots on the ground, and they need more tools. So that's how we got this idea. But for those of you in the audience who work in government, municipalities, bureaucracies, I think we all know it's really not that simple. It would be great if we could just snap our fingers and, okay, no problem, here's a new funding opportunity. But in fact, it was not like that. Surprise, surprise. Because although where I work in housing and Ontario Works, which is administered through the city, both are under the city of Ottawa. Those two do not work together. We don't have, shared data. We do not have shared like streams to administer funding. We do not have shared reporting requirements. So we had to break down a lot of barriers. We had to talk a lot about client confidentiality, privacy, data sharing, reporting, evaluation, and the actual practicalities of funding housing money through employment and social services, and through those caseworkers, and then getting the data we need and reporting it back to our housing funders, because that's what we have to do when we receive money from the federal and provincial government, and the city, but specifically they have specific requirements that we needed. So we just had to, like keep running into that wall again and again until eventually it fell down. And that's where it was a big lift from the team in Ottawa. Now we have new policies, new operating procedures, new cost centers, new data trackers. So all of these things allowed us to be where we are today when it comes to the actual administering of this program. And we learned a lot as well. So the hope is we can expand this and take these learnings and move them forward. But that's sort of the story that brought us to like that first day where we had an Ontario caseworker finally in August of 22 be able to put up their hand and say, I have a client and they're going to lose housing really soon. And what can we do? And we actually had, a tool that we could say, here's something you can offer them. That was a good day.
Thanks so much, all of you. I really appreciate getting that context on your work. Now I want to get into some of the juicy part that I think a lot of folks in the audience are looking forward to hearing about, and get into some of the additional costs that are created by choosing not to intervene earlier in a person's life. So to start, let's talk about some of the immediate costs that increase for individuals when we wait too long to intervene. So could you tell us what your projects have uncovered about some of the individual level or private costs that come up when we don't prevent homelessness? I thought we could start with Melissa for this one, if you're comfortable with that.
Sure, thank you so much. I'm going to try and share again just so that I can refer to this. And hopefully this is just one of the infographics that we pulled. Sorry, I'm just getting my notes here. That we pulled out of the report for you to refer to. And I think I'm going to try to find a balance. There is a lot that is in the report around how these calculations were made. You can refer to the report with some of the validity questions and some of those things. And so I'll try to find that balance today between, providing the information as to how we got here. A couple of things that I noted earlier is I should just make note of those things that were omitted from this section. So one of those is we recognize there's also costs to landlords when an eviction happens, but because we are a tenant-focused program, we have decided to focus primarily on that cost since they're the primary beneficiary of the work of BC Rent Bank. We also didn't include other potential costs that could be there for a renter. These are things like, what is the cost of fighting an eviction, increased transportation costs, loss of security deposit, utility hookups, loss of employment. These are also costs that are felt at the individual level, but we wanted to sort of keep this study tight on some of those direct costs. And as you'll note in the study, we referred a lot to this BC evictions mapping project, again, that First United did, as well as using some of the 2023 rental market data. So there are a few key areas that we focused on, and these are higher rent, moving storage costs, and lost possessions. So for the higher rent costs, in BC, as you may know, rent increases are mostly tied to the inflation rate, but this only applies to rentals in which the occupant is there for the same year. So once that transition happens, there can be an increase in that rental costs. So when it becomes vacant, the landlord can then increase the rent to align with the current market rents. So we looked at the data that was reported in our own program by tenants about their average rental costs. And then we looked at data, again, from CMHC and others, and looked at it and determined a 25% increase, or the equivalent of $457 a month. So in this scenario, we looked at households that would have had to secure housing within a month, and those that would have taken, upwards of 6 months to find new housing as well. I will note that for 12% of the households in our study, we did not include them because we assumed they were entering into a longer period of becoming unhoused. And it's likely that they would have re-entered into the market either through supportive housing, subsidized rental markets, or social housing. So that's sort of some of the factors that came into the calculation around the higher rent costs. As far as moving and storage costs, we didn't actually have a lot of updated data. We had to go back to 2005 and some of the CMHC data. And so we estimated the average would be $519, which we believe is on the low end of moving costs. And we applied these to 44% of the households in the study. And for lost possessions, again, looking at CMHC data, we looked at those who might have to leave their possessions behind because they couldn't afford moving and storage costs. And so we applied these costs to 50% of the households. And again, an echoing theme. This is probably a conservative estimate. A lot of the studies that have been done around the loss of possession often include studies around single men or single individuals. And we know that even within the rent bank world, that we are often assisting a lot of families. And so there are increased costs that come with being a family unit versus an individual when you experience those. So taking a look at these three elements, so the higher rent, the moving in storage, and the loss of possession, what we came to is that it would be about a $16.1 million savings for renters themselves had that eviction been prevented. So thanks so much, Cedar.
Well, thank you for that. Really appreciate the effort that went into getting those hard numbers. I thought I'd go to Sarah next, please.
So I don't have as many kind of hard numbers as you have, Melissa, as I know you were doing a really thorough report. But I can really speak to some of the immediate costs in shelter, which I do have the numbers for, and then I'll speak to some additional costs. Maybe just because it will be visually helpful, Promise, could you share the second slide that I presented in my introduction again? Perfect, thank you. So here you can see the cost of shelter in Ottawa, as opposed to the cost of the average benefit for single adults and for families with the bridge funding benefit. So as I mentioned earlier, it's very significant. I just wanted to revisit these numbers. It's about 200% more expensive to have a single adult in shelter. And about almost 500% more to have a family in shelter. And I would have to agree with Melissa deeply that these are often underestimates. We're just being conservative. But there are a lot of different circumstances. So for example, if you look at the single adults, this is considering adults in community shelters, but for a variety of reasons, the physical distancing centers that I mentioned earlier that were open during COVID, and there are still some operating, not at all like in kind of peak COVID, but we've not been able to close all of them. They're much more expensive. So in the physical distancing centers, a client, their average cost per day is $105. So, that is really substantial. So this is just kind of like at the lowest estimate. But there are other immediate costs that I just want to flag as well. The first being really the cost of a less expensive unit being lost in our community. So you could actually take down the slide if you'd like, Promise, because I just wanted to give people the opportunity to look at those numbers again. Thank you. So the cost of having a less expensive unit in our community lost. I think we all felt, no matter where we are across the country, that huge increase that happened in rent costs throughout COVID. And what we know is when we have a family in situ who have been supporting a lower cost unit for a long time, if they lose that unit will be reposted at a much higher rate. And when the family, receives the support they need to leave the shelter, they will be going into another unit that is also at a much higher rate than the unit that they lost because we weren't able to prevent that homelessness. So we are trying to protect the stock of affordable housing within our community and also protect the housing affordability for that family or that household, because maybe one day they will not be eligible for whatever benefits they're receiving because they have found, really great employment or their circumstances have changed. And we would love for them to still be in that more accessible, less expensive unit. Of course, the cost of shelter. So they leave that unit if they become homeless, lose the less expensive rent, they enter shelter. Shelter is expensive. That's a cost to the municipality and to taxpayers, but it also has many personal costs for that individual as well. And then again, when they leave, they're entering a more expensive unit, but also the primary way that we have individuals and households leave the shelters in Ottawa are through long-term housing benefits. And now we are having a housing benefit that is being paid on a higher rent than was previously necessary, and for a much longer period of time than just, the kind of 3 to 6 months that clients are often accessing the bridge funding program. Because it's indefinite, it's in perpetuity until they are no longer in need of that housing benefit. So it's really about fronting the cost at the beginning by giving them the tools to stay in that apartment and then sustain that less expensive apartment. And you just see those immediate costs echoing all through our system as the rents go up and up and up and we lose more and more of those units. yeah, so that's from my perspective where I see those.
Brilliant. Thank you for that. Lucy, do you have anything you'd like to add?
I think it's already been kind of discussed at good length. Maybe the only thing I'll add, I mean, in the work that I do, typically we're operating on the find out end of things, not so much the prevention side of things. So it's more difficult to look at individual costs in the short term, but there are definitely other costs that are in the medium to long term incurred by the individual when you're experiencing homelessness. Like I'm thinking it because I've come from the healthcare perspective. I think about long-term deterioration of health, reduction in functional capacity. These things are something that is experienced by the individual and can be long-term to permanent. Um, and that does have a lot of individual impacts on the individual in terms of both becoming rehoused, but also just functioning after becoming rehoused. Otherwise, I don't really have any numbers or statistics to add.
Thank you. Next, moving on from the kind of personal stuff, wanted to zoom out and think about some of the public costs we already touched on a little bit. It's important to understand how tax dollars are impacted by the choice to not invest in homelessness prevention. The upfront costs of investing in prevention can seem really steep, but as your projects demonstrate, it's actually far more expensive for our public systems to address homelessness and its impacts when we don't do this upfront investment. So, what do your projects tell us about the additional costs that are created in our public systems when we don't intervene earlier to prevent homelessness? I thought I'd start with Sarah on this one.
Either. Well, as I said, there's the loss of the stock of affordable housing in our cities, and we have a crisis in which the cost of rent is inaccessible for people who are on social assistance or disability support. And for many people who are just like low income working people, it is really stifling. So that's one that I see every day in the work that I do. I mean, of course, the healthcare costs, I'll leave to Lucy to really speak to that in her expertise, but that is very topical. We see that all the time. We hear about that all the time as well. So I look forward to getting to hear what Lucy has to say about, the numbers there. And the kind of, we see the mental and physical health deterioration in clients, the loss of employment, the loss of social, and economic productivity as people are living in crisis. It is so hard for a family, living in shelter to maintain like gainful employment. It is just, like always kind of playing catch up because we see that housing is such a core need. So I think there is that larger loss to society, not just the taxpayer, but for that individual as well. And just kind of the last thing I would say, because it really is, close to home for me, is thinking about the impact for children. I think we all know that being in shelter is really terrible for children. It's bad for their physical, mental, emotional well-being. It's bad for their education. And children who are in shelter have a far, far higher rate of using shelter services again when they are older. So I think we just need to look at that generational impact as well is very important, and the cost that has. It's never ideal. It's never fine for children to be growing up in motel rooms. So we need to be preventing that for the long term and kind of systemic impacts that has for them as well. So I think that pretty much concludes my thoughts on it.
Well, thank you. Maybe we'll go to Lucy next. And yeah, I'd love to hear what you think about this from in the health perspective, but in particular, I'd be interested in hearing more about the long-term health consequences that you mentioned, among anything else you'd like to share.
Sure. Yeah. So again, I'm coming from this from a healthcare perspective, but maybe it's before I even get into this, maybe it's worth talking about two different ways that you see disparities sort of manifest in terms and what people count as costs. The first, there's a situation here where we have extra service happening because the group has an inherently higher average level of medical complexity, which would have been true whether or not the homelessness was present, okay? And this is true by definition because there's always been some number of people who enter homelessness because of their medical complexity, which makes things like holding down a job or maintaining residency quite difficult. That's one side of things. And then there's another side where you have extra healthcare or services needed because of new or worsening health issues resulting from the homelessness itself. And that's the part that people often try to isolate in these sort of cost effectiveness type discussions, the so-called preventable stuff. I'll just give one small example within the health context, but I think it's true across many sectors. Take somebody in the chat was talking about amputation. So let's talk about somebody with diabetes as an example. If that person is also homeless, they have a whole host of barriers to getting appropriate care and management for that condition, between, getting diagnosed in the first place to getting access to appropriate recommended nutrition, to barriers to getting good follow-up and lab testing care, stuff that would be routine for anyone else. There are extra barriers to any of those things, and all of those barriers lead to higher rates of inappropriate management for their diabetes. And that in turn leads to higher rates of complications. And that's like serious stuff. So we talked to somebody in the chat was talking about amputation. That happens because of gangrene. People are getting neuropathy. People are having glaucoma at higher rates because of this inability to manage the condition. And any one of those obviously has an impact on the individual, but also on the system, in this case, the healthcare system, because the healthcare system now has to provide services for that individual who is now more medically complex than they would have otherwise been without the homelessness. So this is just one very specific example, but it cascades across almost every single dimension of health, and I include mental health and substance use in that. And that's how you end up with a group that overall is extremely complex healthcare wise compared to a general sort of housed population. It's like a cumulative damage over time. The longer that somebody remains homeless, the more and more things happen while you're homeless that could affect your overall health and well-being. And those do incur costs over time.
Great, thank you so much. Melissa, do you have anything you'd like to add?
I do, and I'll share again if that's okay with everyone, but I'll try to be a little bit quicker on this one because I think that Lucy has done a great job of presenting some of those health costs for us. But as you look at this slide, just a couple of things to take note of. So we are referring to providing government services, but in the report, we don't break that down between municipal and provincial, although most of these would fall to provincial costs. We focused on costs specifically related to homelessness, and we know that the impacts for those that are not experiencing homelessness are great, but those impacts are often complex and difficult to monetize. And I'll also note in these stats that we looked at the costs, the emergency shelter, healthcare, housing placement and support, and placement and care costs when we came up with these calculations of the $11.4 million in savings. And again, we didn't include costs relating to policing, incarceration, the justice system, and other costs that we know do come at a public cost. I won't go into the breakdown of each of these ones this time, as you can refer to the report and how we came up with the calculations on each of them. I'll just note in the housing placement and support that one thing we did break down is we assumed different categories of support between low, moderate, and high need individuals in some of those calculations. And so again, public and private costs are quite substantial, and this report just really tried to break it down to these very specific categories so that people can refer to the report and just really have a convincing direct costs kind of associated with it. Thanks.
Well, thanks to all three of you for that. So before we get into questions from our audience, and I'd like to encourage folks in the audience to keep submitting your questions. You can use the Q&A feature at the bottom of your screen. So before we get into that, I wanted to talk about some of the barriers that get in the way of your research and practice. And the first key barrier that we talked about in our planning chat was around how silos in public systems create challenges for understanding and addressing homelessness. How have silos shown up in your work? And I thought maybe we could go to Lucy first, if you have anything you'd like to add there.
Yeah, sure. Yeah, silos suck. They're a major headache. From a research perspective, we mostly see siloing from a legal and privacy perspective. When we have research data, we can theoretically get consents and ethics to link to a certain sector like health or whatever in order to follow people through that administrative data. And in this case, when we're talking about costing, administrative data really is the ideal type of data to use to get a sense for what costs look like. But the tricky part is when you're talking about something that has broad cross-sectoral sort of impact, like homelessness. It's clearly affecting a whole whackload of sectors aside from health, aside from emergency housing, aside from justice sector. And each of those sectors have very different legislation governing the types of data that they collect, the types of data, how it's managed, how it's regulated, and how you can access it. And navigating that is extremely challenging, even with with research data, but even worse when you don't have research data and you're working strictly with administrative data. In some countries, not Canada, unfortunately, you do have the ability to link administrative data cross-sectorally much more comprehensively. I think of Denmark as the example, but there are many others as well. And in those places, you do have the ability to do a lot more work for things like comprehensively measuring the benefits of social programs and things that are really important to really get a better sense for what the cost benefit analysis is for different programs. So it's not like it's impossible to have a legal and privacy framework that allows you to do these things. It's just we don't have it. The current landscape that we have considers risk in a very narrow sense, and that causes the siloing. And the result is that we have a serious impediment to evaluating our systems. And that's not just homelessness. That's actually all of our systems have this problem. And the overall effect is friction to moving away from a sort of laissez-faire, do nothing sort of business as usual situation. Somebody in the comments talked about sort of neoliberalism. That's definitely the effect, is that you have a lot of impediments to trying something new and seeing the benefits, if there are benefits to that new thing. So I kind of strayed away from the research side of things, but that's how siloing works in my perspective.
Thank you so much. Melissa.
I'm going to take Lucy's slogan, silos suck, and just put it on a bumper sticker or something like that. But we did have data as well, but I think I'll leave that to Lucy. She's covered that really well. And I should note that I noticed in the participant group that there are a number of representatives from our rent bank partners here today. So I just want to give a shout out to all the hard work that they're doing. And so I hope I'm representing you well in this and some of the challenges that you see in your work. One of the things that we often see is a lack of coordination between services. So rent banks end up actually being like system navigators for folks because they need connecting points into all these different spaces. And so a lot of the public systems are operating very separately. And so how do you gain access to those? And rent banks in particular, we often see individuals who have not had to access social services before, so they don't even know how to do it. They've never been faced with a situation. And so they need a little bit of support in that. Also, I'd say another silo is just accessing government benefits in general. Right now, a large percentage of people coming to the rent banks are experiencing medical issues. And so they're on wait lists and they're waiting for benefits, whether that's EI, PWD, all these other things. And so that's where a rent bank can step in and act as bridge funding until they can get back onto those benefits and see those. I'd say another gap that I just want to highlight is just around funding and eligibility. And we're even guilty of that. We have funding restrictions on the funds that we're able to use at the rent bank program. And so those traditionally go out in the form, say, of interest-free loans. And it's only through partnerships with programs like Reaching Home or the recently we started with Canada BC Housing Benefit Program that we're able to enhance the work of rent bank programs by offering non-repayable grants or rent supplements. And so too often people are trying to seek assistance, but there's funding eligibility requirements. And so they have to like piece and parcel it out from different places in order to try to make things work. So those are a few that came to mind for me.
Thank you. That's really interesting. I appreciate you covering such a wide spectrum of issues. But I was wondering, Melissa, before we move on, would you mind getting into a little more detail about the system navigations issues that you described and maybe just break it down in a bit more detail?
Yeah, I think that, when we talk about rent bank work, we often look at it from sort of the financial assistance that we're providing to renters. And that's a great element of the work that we do. But rent banks actually, and the staff there, spend a considerable amount of time working with the renter to look at what is going on in your situation, because the rent bank loan may not be the best solution out there. So it's like, we're not in the business of measuring success by the number of loans that we issue to people. And so often it requires a little bit of assistance by a case manager at a rent bank to help connect that person to the right service that they need. Sometimes renters are just unaware that they're eligible for certain benefits, whether that's, I have a program called SAFER or RAP or these kinds of support programs. And so I think sometimes people can look at the rent bank program and say, is it cost effective because you only issued X number of loans compared to the number of people that you helped or had apply? But rent banks are doing more wraparound support in looking at the whole picture of what's going on in that renter's life and saying, okay, even if we intervene here, you're going to need support, down the road. And so do you need to connect to debt consolidation? There's a lot of work that's done around landlord tenancy rights. These kinds of things are where a rent bank really steps in and helps to connect that renter to services beyond their immediate need.
Awesome. Thank you for that. Sarah, over to you about silos.
Right, thanks so much. Yeah, I mean, I have to just agree so much with what Melissa has been saying about the importance of those wraparound supports. And I think silos are the enemy of wraparound supports. Guys, silos do suck. Silos are the worst. Health, of course, is a huge one. So in Ottawa, we use a very common housing information management system. It's called HIFIS. And HIFIS is not PHIPA compliant, which means we cannot gather information from organizations that are also stewards of health information. And in Ottawa, we work with all sorts of those types of organizations, community health and resource centers, mental health and addictions organizations. You can see the incredible overlap that we have with services, and yet we cannot put the information about people who are coming from these health services into that system. So it is extremely complicated. And I have to say, I'm so interested, Lucy, in kind of your overview of how that's done differently in other countries. But we are seeing an increased kind of linkage between health and homelessness in the narrative, and we really need to work at solving the issue of those silos. Another example I see all the time that came to mind is within the newcomer sector. Newcomers have really unique needs, and especially newly arrived Canadians, you can't prevent housing loss if they never had housing. And so we really need to be working very closely with the federal government, Immigration, Refugee Citizenship Canada, and with newcomer serving organizations to prevent that from a totally different lens. We're not even really looking at housing loss prevention. We're really looking at ensuring they have housing first, and then preventing the loss of that. Because in Ottawa, over 60% of households in shelter are newcomers. So that is a huge, huge challenge right there. But I do want to share kind of a happy story, I guess, of what happens when you can successfully break down a silo, just to maybe take a little bit of a counter narrative. I did speak to the incredible lift of the team that worked on the bridge funding program when it came to breaking down silos. And I just want to acknowledge first and foremost that this is just within the city of Ottawa. So we're not even talking like sector-wide or even different organizations or even different departments, because I'm going to just talk about in the city of Ottawa are community and social services. Community and social services would include housing, employment and social services, childcare, and long-term care. But even amongst those kind of four branches of this same department, we can't really talk to each other. We don't have permission to share client data. We don't have shared funding streams largely, like things are really separate. So in order for bridge funding to happen, we really had to break down some of those silos. And while we were at it, we thought like, if we're going to ask clients if we can share information between housing and employment and social services, maybe we could just see if we can also ask them if it's appropriate, if we can share with childcare or long-term care or other needs that they might have. That way, if we have a client that really needs something, we don't have to kick them back to the beginning and be like, let's start from the top and work your way into those services. So one of the things that we created was a permission form from clients to share information. And the way that ended up working, if I could share just one success story, was we had a mother with 4 children, one of whom had very high special needs. And as a result of that, the child had not been successful in being able to be in regular educational programming. So because of that, the mother had to cut down their hours at work and was working only part-time and had entered into arrears and was now at risk of losing their housing. And it was at that point that the caseworker at Ontario Works, picked up on this and said, this is an imminent risk of housing loss. How can we support? And because we had kind of looked at all those silos just within this one area and said, how maybe we can, work together better, we were able to use the child care supports within the city to help this client get better supports for their child. In turn, Employment and Social Services then picked it up and helped the mother reconnect further to work, which allowed them to catch up on their housing. And then they were able to come off the bridge funding program, again, a housing program, and carry on successfully after about 5 months on the program. So that would be, what I would see as the benefit of what can happen. But it's very complicated. I'm not trying to oversimplify it all. Just to say that breaking down silos is incredibly effective when it can be done. And I know that we all face this challenge all the time. So yeah, silos are really difficult.
Thank you. Before we move on, I had a couple of follow-up questions, but one that maybe we should have tackled first is, does anybody feel like giving just a brief definition of what we mean by silos when we're talking about them in this context?
When I think of silos, I think of sectors. So if somebody is working within the healthcare sector, there are like many silos within the healthcare sector, but the bigger problem is with between the health sector and others. So for example, if you want to take housing, shelter data, stuff that would be through a HIFA system, for example, and try to link that to health sector data, both sectors have tons of administrative data that is very rich and useful, but connecting those two together that's where the barrier is.
Awesome. Thank you for that. And Lucy, while we're with you, you posted in the chat about the issues around systems navigation in the healthcare sector too. Do you feel like elaborating on that at all before we move on to another question?
System navigation in terms of, sorry, I'm not sure which response you're referring to.
Yeah, you made a little
For hospital coordination. Yeah. So I work at St. Michael's Hospital. That's where MAP is based, and there are several programs that we have there for assisting patients that are experiencing homelessness within that setting. One of them is called the Navigator program. It's quite good, and the point of that is basically to provide enhanced care coordination for patients experiencing homelessness, because what we found is that patients experiencing homelessness, there are discharge planners, there are people who are, their job is supposed to make sure that the follow-up care happens, but the situation is very, very different for patients who are homeless. The ability to do follow-up care is much, much, much reduced. The supports and infrastructure that we often assume exist for patients is not often available for this group. So having a separate sort of care coordination system for those patients has been extremely helpful, because you end up doing some very, very basic things that you would never imagine having to do. Like I mentioned in the chat, it was things like making sure that people have access or are applying for the various benefits that they're eligible for, which happens all the time, or people who have lost very vital identification, like their health card or their birth certificate or whatever information they need in order to get access to services. Those are things that are very, very common.
Awesome. Thank you for elaborating on that. One last question before we go over to audience questions. But another key barrier that we wanted to look at was how stigma and misconceptions about homelessness have made it more difficult to move your work forward. Can you tell us about how stigma and misconceptions around homelessness have played out in your work? And I'd like to start with, I forget who I was going to. I think it's Sarah on this one.
Thanks, Cedar. I could speak just briefly to that. Two things kind of come to mind to me. The first being the stigma against people who are in receipt of social assistance. It can be very, very difficult to find landlords who are willing to house individuals who are receiving income from social assistance, or who they know are coming from a homelessness situation. So I think that just speaks to why this preservation of existing housing is so key. Even if we have, a housing benefit and the client has the benefits needed to be housed, it can still be so challenging, which can then lead to long shelter stays and impacts to that client. So that's definitely a stigma that impacts the work we do every day. And the other is just really about who becomes homeless. I think Lucy said something really powerful earlier in the session about, there is this idea that mental health or addictions are kind of a primary reason for homelessness. But in fact, there are people who are experiencing homelessness who are come from such varied backgrounds. And in the work that we do, we really see that through the Bridge Funding Program, there are many households who just need like 300, 400 bucks a month for like 3 to 4 months so they can just get back into a more stabilized situation. They're entering into a crisis and they just need a helping hand. And I would just say that stigma around who could come to this situation in their lives is really, in my experience, inaccurate and harmful. And I think that we're seeing, more and more counter narratives, and I'd like to see that continue.
Brilliant, thank you. Melissa.
Thanks. I echo some of what Sarah was saying in that, even at a rent bank program, we used to use language when we started around homelessness prevention. And we still use that, but we do put a lot more emphasis on eviction prevention just because language is so important. So the moment you even say the word homeless or homelessness, people do a word association and they start to get images and ideas. And they were, for rent banks, we are assisting people who have lost their housing and need access to it. But the vast majority of people that we are working with are low to moderate income renters who are making it day to day, but just barely. And then a temporary crisis comes along and destabilizes things for them. And so that's who we work with a lot. And so language around how we talk about these programs and who we're working with, and the fact that they're everyday people just like you and I, and they had something like, a medical issue come up or a car expense that they weren't planning for, and this is what's destabilizing them. And to Sarah's point, it's this idea, I think the stigma around who needs these types of services. It's people that are working every day and they just have that unexpected expense. But the misperception that people just need to work harder or they need to manage their money better. And if they could just manage their money better, they wouldn't be in this situation. And the reality is people are in often cases doing really well. They just don't have access to the same amount of resources that others do. And I think the only other thing I'd mention that's really challenging for us, I don't know if it categorically fits this question, but I think these types of conversations are really important. It's why the report is so important, is because we have to eke out funding on a year-to-year basis and try to justify the value of these programs. And our hope is through reports like this that decision makers will continue to see that investing in eviction prevention and investing in these types of programs is so important in our communities. So that's where I'll end.
Thank you. Lucy.
Thanks. Yeah, I'll echo that. I spend a surprising amount of time and energy dealing with basic misconceptions about homelessness and a lot of the research I end up doing, not just this costing study. And a lot of the misconceptions tend to perpetuate stigma. So a lot of the findings in those studies are the things that have the most traction tend to be stuff that I would consider footnotes. It's description of the population, like, hey, in this cohort, X number of people have this type of mental health disorder, and it's always much, much lower than people expect because people have in their idea a stereotype of what homelessness is, and that kind of speaks to what Melissa was saying about the perceptions of what homelessness is and how that impacts people's willingness to engage with services. There's a public perception, frankly, that's egged on by certain people with certain values and political leanings, that people who are homeless are made up of this like monolith of certain types of people. And that's not the truth. In reality, the people that meet that stereotype are very much a minority. And we know that from representative cohort studies that we've run, the vast majority of people, well, first of all, I won't say the vast majority of people. Homelessness is made up of like a very large, diverse mosaic of all kinds of different people having different capacities and needs and traumas and reasons for being homeless in the first place. But a lot of it is about economics, either on the income side or on the cost of living side. And for all of those people where that's the primary issue, really the solution is the rent subsidies and the affordable housing units and maintaining housing that's already in place. For people who are more complicated, more complex needs, and on average, that does happen more in this group than for others, because as I said before, there are more people who end up homeless because of medical complexity or other things that are happening on top of economic stuff. You do need additional supports beyond rent subsidies, wraparound type supports. And that's really important to keep in mind, because if you just put money in the picture and nothing else, you will get a lot of situations. And you hear about examples of like rent units being trashed and stuff. And there are a lack of supports that make success possible in those cases. And it gives the entire sort of homelessness intervention sector this veneer of it's not possible, right? When that's the furthest thing from the truth. And I guess the only other thing I'll say about stigma is that I feel like and this goes back to my very first comment, the entire business of having to prove the cost effectiveness of homelessness interventions is something that is pretty unique to this sector because of stigma. You don't have to have a strong evidence base on cost effectiveness for a whole host of other social programs that we provide in Canada. And the difference in attitude is very striking. And that does point very, very squarely onto the stigma for homelessness specifically. We're basically saying that for these particular people, their interventions should cost nothing or some marginal amount, and that our care for these individuals comes mostly from their cost to society rather than the inherent benefits of helping people. And that's a problem. And it's unfortunate, like we do have to talk about cost effectiveness in order to convince people who hold the purse strings to do certain things that they should be doing anyways. But at the same time, we're feeding into these sort of stigmatizing sort of perspectives.
Thank you so much for that, Lucy. That actually gets into the first of the questions that I wanted to ask from the audience. And thank you to the audience for all these excellent questions that we have to work with. But the first one I wanted to ask was about, there was a few people talking about how to scale findings up, like how do we make use of these findings? So how do we go about getting this information across to decision makers and using it to make the case for prevention? Maybe I'll just open it up and see if any of you feel like speaking to that instead of putting anyone on the spot.
I can just speak to it briefly, and also just because I want to just like applaud Lucy's last point and just say, how much I couldn't agree more. I think from coming from a social service background, like it is really challenging to have to approach this with such a, like a money hat on, because people need supports, and it's so challenging to have to show that the impact financially as well as empathetically. But in the environment that we're working in, where we're kind of like fighting a fire at all times, trying to like fix a plane while flying it, that is often what needs to happen. And so how we scale up, I think, I can speak from a municipal perspective, is by running these pilots, by taking, relatively small pockets of money. Initially, our initial ask was like $600,000 or something, and then, it grew to $1 million for this pilot, and now it's ongoing. And trying to show the impact and effectiveness of that in a way that reaches more people than it typically would. Not just talking about it, with people in our sector, with people that I think this narrative, like sort of a preaching to the choir, but then, we bring it to council and we advocate to higher levels of government, and we ask for more support and say, this is what we could do with just this small amount. This is what we've done. Can you give us more? Just a small piece of the pie, and trying to change that. But then also looking at it from the public narrative side. I think I saw someone just pop up in the chat briefly saying we needed more information in the public about like who are people who experience homelessness, who are people who lose their housing. And if we had that like groundswell of support, I think people would be demanding, we cannot let people fall into this really precarious situation to go into shelter where ultimately their outcomes are much worse. It's so bad for people. It's so bad for individuals. It's so bad for children. And if we had that being the demand, there would be more political support for that as well. So if we could kind of raise that voice, I think it'd make a big difference.
I think I'll add a few things to scale up. I mean, it's audiences like this that we help, carry forward the message. And so we need to get those out. Canada-wide, we have started the Canadian Rent Bank Coalition, and we have representatives from multiple provinces, Ontario, New Brunswick, Quebec, Manitoba. And we're just trying to do some research projects together as well to elevate the knowledge around rent banks and eviction prevention. I think working at a provincial level, it's kind of a benefit because we can hit both the municipal through our local partners as well as some of the provincial advocacy work that we need to do. But making this information, I totally fall in line with the idea of we don't want to talk about the economics of helping people because there's just a good moral and ethical reason why we should do it. But we do live in a very business-driven world. And so putting these things in front of decision makers in very bite-sized, easy win ways, I think helps to sort of make the case for continued support in it. And while we may all disagree with that, it just speaks to a certain language of, dollars and cents and really clear cuts. So I don't know if Lucy has anything to add.
Yeah, I guess, I mean, any good quality information on this topic can be scaled up when designed for it. So, I mean, Melissa, the report that you guys did, it did use some of the information from the study that I was talking about today in order to estimate healthcare costs. So that's an example of scaling up and sort of extrapolating beyond one setting to another. You can also extrapolate within setting. In the paper, I didn't mention it earlier, but we kind of did a guesstimate of the estimated costs, healthcare costs of homelessness across Toronto, estimating based on a very, very conservative estimate of the number of people we know are homeless on any given day. That's something that you can do, and you can present that to policymakers, and you say, this is the basement level. This is the bare minimum of what we can see. And there are additional hidden costs that we are not able to pull out. You can imagine across all of the sectors, once you add those all together, those are very, very significant costs. And one of the challenges is that because of the federal system in Canada, different governments are responsible for different costs. So one of the things we see often is that we get healthcare, which is provincial, fighting against municipal, which is housing. So if at a municipal level, we're not able to provide community-based supports, that trickles up into provincially funded systems like healthcare. And then the province cares, but the municipal side doesn't. And trying to coordinate between those two to say, hey, if we can work together to provide adequate services upstream, we can all benefit downstream in all of the sort of downstream sectors. And that's the trick. And that's the part where the silos are really, really unfortunate, is because getting a really strong argument and really good quality data to really support that argument is not easily done right now.
Brilliant. Thank you for the insightful answers, folks. Maybe building on that question, we had one audience member who raised the issue of intergovernmental spillover, where the benefit of spending by one level of government accrues to another level of government. So this person said that it's likely that a lot of the health benefits of preventing homelessness would accrue to the provincial government, but could this actually disincentivize spending on prevention by either municipal or federal governments? Just a little bit
I basically said that before, and yes, I think that that's definitely true. So you will see, on the one hand, so the province had in Ontario, they've downloaded a lot of responsibilities around housing and homelessness to municipalities, things that were not the case previously, and for affordable housing as well. Part of that is decoupling who pays for what. And then you can kind of just point at each other and say, oh, you should do this or you should do that. And no one's dealing, and especially dealing with it upstream. So I do think that the further upstream you can deal with something, ideally preventing homelessness altogether, which is what these two individuals have done through their respective programs, the benefits accrue to different systems, and how much accrues kind of depends on the individual affected. But yeah, I think my short answer is yes, it definitely does accrue to different systems.
I think it gets to threads that we've been having around the silo conversation and how do you measure where those are, and the fact that our information is so disconnected from each other. So in the Western world, we tend to think of health in a very distinct way from housing, and these things are not that way. They're interconnected, but it's about being able to illustrate that through these different departments. So.
Sarah, did you want to add anything on that issue?
No, just that I'm in agreement. I think that that was really well said. And I working in the municipal government, I do see I see this. And to Lucy's point, I think we need to take a step back and realize the broad systemic level impact that it really ultimately has for all levels of government if we don't find a way to address this issue.
Thank you. So a lot of audience members, there was a lot of talk in the chat, would be interested in hearing your thoughts on universal basic income and the potential this could offer in being part of the solution. Anybody want to speak to UBI? I know we had a pilot project around that in Ontario that unfortunately got canceled before completion, but
I guess maybe I can start. So I think basic income is part of the equation. A lot of as I said before, a lot of the problems are economic, and income side is a big issue. You can see a lot of people on ODSP, and for those not familiar, ODSP refers to income assistance for people with disabilities. So it's a long-term benefit. It's not something that you are expected to leave. But realistically, that won't be enough, I think, because, and I said this earlier in the discussion, there's a higher average level of complexity in the group. So income is part of the equation. It's a very, very, very important part of it, but it won't be enough. For some people, it will be enough, but many other people, other wraparound supports are needed. So a strong social safety net, in addition to income supports, is sort of the solution that I would like to see happen. One without the other, you'll end up with some situations and people will get frustrated.
I'm not going to add anything. I think Lucy has summarized it well in the sense in what she's kind of elevated. I know at Van City Community Foundation, we also have a living wage program, and there is that income side of it, and ensuring that employers are paying not only bare minimum, but what is a family need in order to live in the province right now. So I'm going to leave it because I think Lucy was much more eloquent.
Yeah, I agree. Lucy was very eloquent. All I would say really is that so much, like I would just have to agree that so much of homelessness is an economic issue. I'm no expert on UBI. I would say that greater financial supports for the average person or for people who are low income is a very important piece of this. And in Ottawa, in Ontario, an individual receiving social assistance via Ontario Works, I think their maximum benefit is $731 a month for shelter, like for housing. And I'm like, who's that? Like, what will that get you? Without an increase in some kind of financial support for individuals, we're just going to see increased housing loss as as these systems of social support and our safety nets continuously and more deeply fail to keep up with the cost of living and the need in our community.
yeah, thank you for that. Pivoting a little bit here. We had a question about, for those of you who are working to kind of prevent situations of homelessness among the folks you're working with, how do you measure long-term sustainability after kind of initial point of crisis? Like, are you looking at whether people are not homeless for like a 6-month period or for longer? But how does that long-term sustainability piece fit into your calculations or work?
Maybe I could just say, because it's very simple, for the bridge funding program, I had indicated that 89% of clients who received bridge funding avoided homelessness. Again, I'm not a researcher, and this is not a research paper, so I do not have a formal definition. For me, for us, that just means that so far, to date, so whether they received the benefit in August 2022 or whether they received it last month, they have not become homeless for the duration of the program. So that's what that means for bridge funding. But I'm sure that there's a more effective definition to be used in research circles.
For us, we look at a couple of things. I know lots of people like to drive the question, like, what is your repayment, for example, in your loan as a measurement? I think looking at the cost benefit of a program like we just presented in this report, we wouldn't even ask those types of questions simply because preventing the eviction itself was cost effective. However, we still see a 70% repayment on loans over the long term, which is pretty high given that we're working with people who are really in vulnerable situations. And it could be very likely that in 6 to 12 months, they have another crisis that comes their way. We are trying to get better at measuring longer term housing stability. We did a study back in 21-22 that looked at recipients 6 months after they had received rent bank assistance, and the respondents, I think the percentage was 94% had maintained or improved their housing. 61% said they would have become homeless without the rent bank program as a support. So there is clear indications that it helps beyond the immediate crisis. What we want to get better at in the future is just being more consistent in measuring that with renters. The challenge is we often have a hard time getting back in touch with people over the long term. Once they receive that financial assistance, we maintain the repayment, but getting them to complete a survey or something of that nature is not always the easiest. So we just want to find ways to become better at measuring some of those longer term housing stability pieces.
I don't have a whole lot to add on that front. I guess maybe the only thing I'll say is that there are people for whom supports will have to be long term. It's not like you put an investment of money for a year or 2 years or whatever, and that's the end of it. There are people for whom wraparound supports are a long term thing, and that's something that we have to just keep in mind. That's a part of providing services where people are at.
Good reminder. Thank you. So one audience member said in the chat that increasingly people with big homes and 2 cars are also relying on food banks out of necessity. So building on that observation, could you elaborate on the differences between how we think housing precarity and homelessness look like versus who is actually at risk in our current climate? Speaking to that misconception piece.
I think just a couple of thoughts from, seeing the development of the program from 2019 until today. The economic times have dramatically changed. The impacts of COVID and then the economic recession or increased cost of living, is having a dramatic impact. And so what our rent banks tell us and what we see from the data collected is that more and more people with higher levels of income are coming to the rent bank for assistance. And we do set a measurement for eligibility around a housing income limit score that's set out in the province, but we've tried to create more flexibility around not capping that so hard because there are more and more folks who are coming to us that have higher levels of income and are needing that kind of support in order to maintain their housing. So yeah, we have data around the demographics and who is coming to the rent bank and who it serves and things like that. But I think in a general term, over the course of the last 5 to 6 years, we can definitely say that there's been an increase in demand. I think in 2019, during that year, we distributed about $250,000 out to renters. Last quarter, it was $750,000 over a 3-month period of time. We're also seeing that people's needs are increasing. So the amount of funding that they're requesting is increasing as well. And the types of people that are coming to the rent bank have shifted over those years.
I'll just add a little bit to what Melissa said, which is that my experience in this sector is that the system for homelessness response that we currently have is based on very antiquated and outdated needs, I think, within the community. Just the sheer volume that we see shows the shift in the reasons why, and how people end up being homeless or experiencing homelessness. And as I said earlier, like it is kind of dramatic, like the difference between the social perception and the reality of who we see experiencing housing precarity and needing those supports. And I think that is reflected in this like incredible climb in numbers of people who are accessing shelter over the past 10, 15, 20 years. I think homelessness has become truly deeply an economic issue. And so that's why I would not be surprised to hear, of people who are maybe on the outside, not presenting in that kind of stigmatized way that people might expect, needing supports for food insecurity, housing insecurity. I think we see that every day.
I don't have a whole lot to add. Maybe just, we know there was a very nice recent report by AMO in Ontario that estimated like the basement level of homelessness at 80,000 people, which is quite a bit higher than in previous years. So part of it is a shifting demographic perhaps, but actually what I think is more happening, and the stressors are coming from volume. We don't have the ability to accommodate the additional volume of more and more people who are entering homelessness and fewer opportunities to exit homelessness. You have this plug in terms of trying to exit homelessness. And some people do, but there are more and more people who are circling and unable to exit. And that's where you start to develop issues that contribute to chronicity of homelessness.
Thank you. So I just want to flag that we are at the kind of hour and a half mark here, but I was thinking it'd be nice to extend a little bit just because we've had a lot of questions and a lot of participation. So I was going to ask two more questions before we wrap up. And one is was asked to Sarah and Melissa about people trying to replicate programs like yours in their communities. How would somebody go about starting a program like the ones you're describing? What tips would you have?
So if you're in the province of BC, you can reach out to me, as well as if you're in another province, and we have Rent Bank, part of that Canadian Rent Bank Coalition. I'd love to connect you with some of the contacts there. We also have a toolkit that we developed in our first year that was sort of a play-by-play how you might go about setting up a rent bank program. So it's a toolkit and a little workbook that helps. I haven't updated it for a while, so it might need a few refreshers, but yeah, we have those kinds of resources available. And so please reach out if you need that.
Thank you. I would say the same as Melissa. If you are in Ontario, or if you just want to, if you think there might be some relation even within your province or within your country, please feel free to reach out to me. I'm happy to speak in more detail. But I would say, yeah, like start by talking to people with their boots on the ground, who can identify people who are in these precarious situations. In our case, we leverage an existing resource within the city staff of 600 caseworkers working with people on social assistance. But we also know, like schools, food banks, community centers, like there are all these places that have touch points with people as they fall into further precarity. And so I would start there and ask them, like, how can we work with you on prevention? Prevention cannot just be like, oh, here's $600, off you go, good luck, let us know how it goes. It does require some additional supports while people are in these challenging moments in their lives. But try to build relationships with those case managers, with those whoever it might be that can really identify clients in need, because that is, I think, a big part is like somebody needs someone to reach out a helping hand and say, I have something and I can help you. And so look for those people in your community. And then, yeah, be prepared, I think, to find some challenges, because if you're dealing with money and putting money in people's pockets, you're going to run into some barriers, but just keep at it. And, I really hope that people do find success in replicating this type of program. I know I myself hope to expand this program. So I wish that luck to everyone on the team working on this as well.
Brilliant, thank you. So one last question. We had one audience member was thinking about the difference between chronic and episodic homelessness, like a difference in needs, difference in causes, and also a difference in the kind of public and political support that those problems get. So does your data collection allow you to distinguish between episodic and chronic homelessness? And in what way do the different causes result in different approaches to advocacy around episodic and chronic homelessness?
I'm not sure if it's a question with regards to research or programs, but I'm going to assume it's both. In our data collection, we do have very extensive information for how long somebody was homeless at baseline, and we prospectively followed our cohort over time. So you can determine over time how many individuals who maybe started out homeless very recently ended up being episodic as opposed to chronically homeless. That was not really a focus of this specific study, but that's one of several things that we want to do moving forward, is talking about what is the changes in costs after somebody becomes housed? What is the difference between chronic versus episodic homelessness in terms of healthcare utilization costs? In terms of the impact, if we do see a difference between those things, I would expect to see a difference between those things, by the way, because like I said earlier, there are additional challenges and sort of accumulating, I don't want to call it damage, but it is basically damage over time that occurs as somebody experiences homelessness for longer and longer and longer. So you would expect different healthcare utilization between those groups, as well as different sort of medical complexity that leads to extra difficulties in exiting homelessness to begin with. in terms of the public appetite for addressing those different issues, in one group, you may have more economic solutions to the homelessness. In others, you can't just rely on economic solutions. You need serious sort of wraparound housing first style supports. And that's something, I mean, housing first, we talk about it a lot less than we used to, but we need to talk about it again, because properly implemented housing first does work for individuals with higher levels of medical complexity, but they need to be implemented as designed. And in a lot of places, they are not.
I'm not sure that we're really great at sort of being able to measure that between, episodic and chronic. We do know, obviously, people returning to the rent bank. We know where they are in their eviction process. We know what kind of financial assistance they're seeking, whether it's for money that's owing in rent or upcoming rent, or first month's rent. So we have this kind of information, as well as a host of demographic, but we don't necessarily, I think through the interview process, so case managers often talk they talk one-on-one with renters more about their situation. And it's through that they can gather more understanding of, like, is this a recurring issue? Has it been for a long time? I mean, even if the person lists their address as a shelter, for example, there's those kind of indicators that we do have. So that's some of the information that we do have.
Within the city, this is not specific to bridge funding, as in bridge funding, we're really looking at that prevention piece, so the households do not become homeless. But in the city of Ottawa, our data folks are really excellent at identifying kind of chronic versus episodic homelessness, in large thanks to our community who enters the data into our data system. So it's all the system working together. But chronic homelessness generally is 180 days out of 365. Or there is like a second piece alternative, but I can't remember the numbers off the top of my head. But I just wanted to second what Lucy said, which is people who are experiencing chronic homelessness, as often as they become more embedded in the system, need really different responses than people who are episodically or very briefly homeless. I think this circles back to what we were saying earlier. People who lose their housing are not a monolith. They have very, very different needs. Somebody who has been in a shelter for 5 years, and somebody who is like, a single individual with complex health needs, and a family who went into arrears and lost their housing due to job loss, are nowhere near each other in terms of appropriate response. And so I think in that sense, we do see quite different kind of focus and response. And at least in Ottawa, our housing first model is targeted towards people who are chronically homeless primarily. So we have different resources allocated depending.
Awesome. Thank you all for that. And thanks again to the audience for all the excellent questions. I'm going to turn it over to Promise just to wrap us up.
Thank you so much for that, Cedar. And yeah, thanks again to our panelists and our audience for everything that you've shared today. Audience, I wanted to give you a special shout out today for being just incredibly engaged, a lot more so than usual. You made our jobs a lot harder in the chat and really put me and Steph to work, but like in the best way, because you all just had so much to say and so much to keep track of, and we just so appreciate it. So without further ado, I'm going to close us out for today's episode. Everybody, sorry, my throat is not impressed with me. It's been like a couple hours since we started here. Everybody, please join me with your reaction emojis and in our chat box to thank all of our panelists for everything that they've shared today, because it truly has been a brilliant conversation and just really informative and insightful about some of those sort of, stereotypes that are associated with homelessness and the solutions and what actually makes the most sense, as opposed to what kind of popular narratives about homelessness are. I also wanted to take a moment to send a special thank you to Cedar, especially because she had to be tagged in at the last minute to act as host for today's panel after our original host couldn't make it. So everybody, please especially send a special thank you Cedar's way for just coming in with such limited prep and absolutely bulldozing and killing the role. If you'd like to get in touch with any of the wonderful people who've spoken today and learn more about their programs or find ways to collaborate, as they all mentioned, they're so ready to talk, so ready to get in touch, so ready to provide whatever support they can to move this work forward. And so I'll just encourage you, if you'd like to get in touch with any of them, to reach out to us via the contact information that I've put up on the screen, and we'll be able to get you connected with them accordingly. Um, the other thing that I wanted to tell you before we wrap up for the day is that once again, your feedback is extremely important to us. It informs the way that we go about structuring the episodes. In some cases, the things that are shared in the feedback form have ended up becoming the foundation for the topic that we pick for an episode. And so, if there's anything about the show that you want us to know, if there are any topics you want us to cover, if there's even specific guests where you're like, I ran into this incredibly brilliant person that's doing this work, and I think they should be brought to this platform, we do check the form. It's our way of hearing from you about your thoughts. And so we really encourage you to share your thoughts there. Even if you're just writing in to let us know that like we should keep doing what we're doing and you're just really enjoying like the episodes that you've been able to attend so far. It means a lot, and it just really helps us out in terms of, figuring out where to allocate our efforts planning wise. So please, please, please do feel free to make use of the form and send a quick note on your way out before you head out for lunch or whatever else you might have going on today. The final thing that I wanted to highlight before sending you all on your merry way is that next month's panel is, I mean, I feel like every month I'm like, it's gonna be so cool and interesting, and like I'm just a nerd. But I promise that it's genuinely going to be a good and interesting episode. The topic that we're looking at next month is around the landlord engagement piece, recognizing that, especially in our current housing context, there is a lot about how the rental market operates that is kind of escalating housing precarity for a lot of people, and especially certain marginalized communities. And so we want to take some time to engage with what it looks like to productively cooperate with certain landlords who might not necessarily be like why is the term escaping me, like like a big investor that's like a corporation or something, but is still ultimately a person that wants to provide housing but is also navigating barriers of their own, right? So next month's panel is just going to be focused on what it looks like to productively engage with people who are renting out units to ensure that we're able to create a landscape that looks a little safer for everyone, and kind of the role that plays in preventing homelessness for a bunch of different groups. And so I really hope to see a lot of you there for that one as well. With that being said, I'd just like to wish you all a wonderful morning, afternoon, or evening, wherever you're calling in from, and a wonderful rest of your day. And whether I see you at next month's landlord engagement focused episode or a couple months down the line, I just hope to see you at another one of these panel discussions really, really soon. So yeah, thanks again. Thanks to our panelists. Thank you especially to Cedar. And take care, everybody.